Sawyer and I are here to do a quick video about fat emboli versus blood embolus, what the difference is, and which one you're at risk of if you have tummy tuck. This is from a question on one of my TikToks about whether tummy tuck puts you at risk of fat emboli. It does not. Fat embolus can happen with fat injection, like Brazilian butt lift, because you're injecting large amounts of fat into the soft tissue, and when it gets into the intramuscular tissue, there's a lot of large veins. So that, when you hear about fat embolism in relation to plastic surgery, that's when it's happening with BBL. For tummy tuck, or really any large surgery, it does increase the risk of a deep vein thrombosis. That is a clot in the deep veins in your legs, and it can break off and travel to the lungs. That's the embolus part. The embolus is a clot breaking off and traveling to the lungs. Having surgery over 45 minutes does put you at increased risk. There's something called the Caprini scoring system that I go through with all of my patients at their pre-op visit. It's based on age, BMI, whether you're on hormonal contraceptives or hormone replacement therapy, if you have a history of ulcerative colitis, if you have a family history of blood clots. All of these things assess your risk factors for blood clots. So if you have above a certain score, then we put you on Lovenox, which is a blood thinner, which is preventative. For most people, they aren't that high risk. Getting up and walking around right after surgery, in that first day or two helps decrease the risk of blood clots. So yes, surgery is a risk for blood clots, tummy tuck especially, because you're tightening the abdomen, which can decrease the venous outflow from your legs. Basically, it can make it harder for the blood in your legs to come up to your heart. Not tremendously harder, but a little bit harder. And because it's harder for people to move around. That said, it's a risk that we assess and treat, and not something I would personally, it would not keep me from having a tummy tuck.